So from the people that you've spoken to in respect of this, what are they saying to you?
Well, Jeremy, it's quite interesting. We saw the news over the weekend that possibly a large number of doctors, it's expected the exodus of doctors going to various other countries, leaving South Africa because of the NHI bill. But what we're really finding out on the ground, that the news itself took a number of people by surprise, even the professionals themselves, the board, for example, the Board of Healthcare Funders, which basically administers practice codes and numbering system. In order for you as a private doctor to be registered within the system, you need to be registered with the Board of Health Care Funders, and they're saying that they're not seeing these numbers being reflected to them, for example. Instead, they're seeing a large number of professionals coming in. But let's hear Dr. Rajesh Patel and what he had to say on that.
Over the weekend.
Yeah, I've seen that headlines over the weekend regarding all the people that are leaving the country. BHF administers the practice code numbering system, and as far as we're concerned and what we see, we don't see the rush of resignations from the practice code numbering system at all.
All right, so the lesson there is let's not overreact, but it still is a worrying concern. The research itself was done, I understand, by the trade union Solidarity.
Solidarity, yes. Nicolina, beg your pardon, from Solidarity put together this research. I spoke to her actually a couple of hours ago, and to just basically understand what was happening. And she's basically told me that out of the 4,000 members that they had in the healthcare, she spoke to about 306 of them, so that's where this number comes from. And it was for Solidarity, it wasn't for the broader profession as a whole. So she just was at pains in basically explaining that this was an internal process for Solidarity and not a reflection on the profession in itself. Let's hear what she had to say herself.
We are going to leave it there. Thank you very much indeed, and we'll continue to follow that story, I think, with a great deal of interest.